Hi, I'm Dr. Nathan, and I'd like to talk about the wide awake local anesthetic technique for hand surgery. Traditionally, when we perform operations on the hand and wrist, it required a tourniquet so that we can control bleeding. The tourniquet would go on the upper arm after pushing the blood out. After 10 or 15 minutes of having a tourniquet, although it's safe, it's uncomfortable. So we also required the use of anesthesia, either regional, where the whole arm is put to sleep by a nerve block, and general anesthesia, where people are given drugs through intravenous lines to sedate them or put them totally unconscious, which is general anesthesia. The downsides of general anesthesia and the regional blocks are many. First and foremost, it's invasive. People have reactions to the anesthetics. They can feel sick afterwards. Having general anesthetic requires an anesthesiologist, and it requires confidence that people are healthy enough to undergo general anesthesia. There's also the added expense of having the anesthetic, which occurs usually in a surgery center setting or hospital, where there's a staff of anesthesiologists, nursing staff, and sometimes anesthetists. In 2005, Dr. Donald WALANT, who's a Canadian and our past president of the American Society of Surgery of the Hand, presented the concept of wide awake local anesthesia no tourniquet, otherwise called WALANT, W-A-L-A-N-T. The technique involves instilling local anesthetic into the site we're operating with a small amount of epinephrine, which controls bleeding. The patient population undergoing, for the most part, small hand surgery operations were much more satisfied, and it was much safer than undergoing similar small operations in an operating room theater, either in a surgery center or in a hospital. For the past 10 years, we've used this technique largely in the surgery center, but since COVID, we've incorporated this in the office setting, as was described initially by Dr. Lalonde. We found that it's been extremely well tolerated and appreciated by our patients. The technique has the advantage of using no medications other than the local. So patients, although may have a concern or be nervous, universally when we lay them down on a comfortable setting in the office or in the surgery center, we have some light music. We have a drape that blocks their visibility of the operation. The small amount of epinephrine controls the bleeding, so we do not need a tourniquet. The main advantages of this technique over going to the hospital or surgery center is, as I mentioned, one is not given any other medications except the local. It's safe, and because one is not given any other medication, there is no need for a preoperative evaluation, just like going to the dentist. Patients are wide awake and they're given no sedatives, so they can drive home. So the need for pain medications, including narcotics, is really minimized. So people feel better and recover quicker. The many operations we do, it's beneficial to have someone awake so we can actually determine the functional outcome of what we're doing. If we're doing a small tendon repair or certain types of small fractures, we can actually have the patient move the hand during the middle of the operation because they're not under anesthesia.